Hello, this is Medicare Basics. What should you know and consider? Provided by the Nebraska SHIP and SMP. Nebraska SHIP and SMP are both federally funded programs through the ACL, the Administration for Community Living, and exist to provide local help on the topic of Medicare health insurance. The acronym SHIP stands for State Health Insurance Assistance Program. This program's mission is to provide unbiased Medicare education and counseling to empower people with Medicare to make informed decisions about their health care. The acronym SMP stands for Senior Medicare Patrol. This program works to help people prevent, detect, and report potential suspected Medicare fraud through outreach and education. The federal funding means there is a SHIP and SMP program office in all 50 states and U.S. territories. Each program is typically managed by a state agency. Here in Nebraska, we are a division of the Nebraska Department of Insurance, and we have 7 locations to serve you in partnership with Area Agency on Aging offices and volunteers assisting seniors in the Omaha location. Now, our main office is located in Lincoln. Our other locations include Omaha, Grand Island, Kearney, North Platte, Scottsbluff, and Norfolk. These 7 locations serve as a home base to over 250 volunteer counselors. When you call our hotline, you will be able to select the office closest to you. Finally, our website provides basic information about Medicare, but remember, Medicare is individual insurance, so a visit with one of our counselors may be beneficial in your planning. This presentation will address the average individual, and the topics that will be covered will include what is Medicare, Medicare Part A and Part B, Medicare supplements, also known as Medigap, Medicare Part D drug coverage, Medicare Advantage, also known as Part C, and finally, protecting your Medicare. So what is Medicare? To put it simply, Medicare is federal health insurance created in 1965, signed into law by President Lyndon Johnson. Initially, Medicare was only available to people who were age 65 or older. It wasn't until 1972 that Medicare was expanded to include coverage for individuals younger than 65, providing coverage for those with a qualifying disability or those with end-stage renal disease. To qualify for Medicare health insurance, a person simply needs to fit into one of these 3 categories. When you become Medicare eligible, you will need to decide how you want to receive your Medicare benefits. You will have 2 options, Original Medicare or Medicare Advantage. Visually, we're showing that Original Medicare could consist of 4 individual parts, whereas Medicare Advantage combines parts of Medicare into one package. Both offer equal coverage, but have different rules and cost structures, so you will need to decide which option will best fit your needs. Also remember that Medicare is individual insurance. What works well for your friends and neighbors may not work well for you. You truly should do an individual comparison of your options. If you like statistics, as of September 2024, 49% of people with Medicare in the U.S. overall were receiving their Medicare through the Original Medicare option. The majority, at 51%, were enrolled into Medicare Advantage. This was the most recent data available at the time of this recording. Here's a look at enrollment between Original Medicare versus Medicare Advantage in Nebraska as of September 2024. Unlike the U.S., we see that the majority of Nebraskans with Medicare have opted to receive their coverage through the Original Medicare option at 66%. The other 34% of Nebraskans with Medicare have chosen to receive their coverage through Medicare Advantage. Now, potentially this could have changed during Medicare's open enrollment, which runs from October 15th through December 7th. Today, we're going to break these 2 options down. We will start with Medicare Part A and Part B. Medicare Part A will serve as your hospital insurance. It will cover these 4 services shown on the slide: inpatient hospital care, skilled nursing facility care, home health care, and hospice. Part A is typically premium free for most people since it's already been paid for through 10 years of employment, paying Social Security, Medicare taxes. When you do use your Medicare Part A, you will be responsible for deductibles and copays. In the event of an inpatient hospitalization, you would be responsible for the $1,676 deductible, which pays for the first 60 days in the hospital. Medicare will cover all other costs during this 60-day period, including prescriptions administered during this stay. Now, should you require hospitalization beyond 60 days, Medicare does cover up to 150 days. However, you will be responsible for a daily copay for days 61 through 150. Hospitalization cost after 150 days will be 100% your responsibility unless you have a Medicare supplement. Now, in the event that you need skilled nursing care, Medicare Part A pays for the first 20 days at 100%. If you require care beyond 20 days, you will have a daily copay for days 21 through 100. Also, please do not confuse skilled nursing care with a move into a nursing home. Medicare, like most insurance, does not cover long-term care cost. Instead, think of skilled nursing as a rehab stay, perhaps receiving physical or speech therapy. One thing to note, do not assume that an overnight stay in the hospital means that you are an inpatient. This is a very common mistake. Now, if you're kept overnight in a hospital, it's a good idea to find out what your status is, inpatient or outpatient. The distinction makes a difference on your out-of-pocket cost. Often, an overnight stay could be classified as outpatient observation status, meaning that your Medicare Part B would be billed for that particular stay. Medicare Part B is your medical insurance. This will be the part of your Medicare that may be used the most, paying for outpatient services that are medically necessary, like a doctor or specialist visit, outpatient care, mental health care, home health services, and durable medical equipment like a walker, a wheelchair, or even a CPAP machine. Preventative services are also covered by Medicare Part B, like the flu shot or a cancer screening. For a list of common Medicare-covered tests, services, or items, you can refer to the Medicare and You Handbook, which you will receive with your Medicare card and each year in the fall once enrolled. Medicare Part B has a monthly premium. This year, the standard premium is $185 per month. Now, those individuals with higher incomes may pay an IRMA. IRMA is based on a person's modified adjusted gross income from their tax return from 2 years ago. If a person's income was more than $106,000 individually or $212,000 as a part of a married couple, IRMA may be imposed and you would receive a notification by letter. The letter will provide details and communicate what your Part B premium will be for the calendar year. There will also be instructions included in the letter that will tell you how you may appeal the IRMA determination if you feel that your income 2 years prior is not a correct reflection of your current income. Part B also has an annual deductible, which this year is $257. Once the deductible has been met, you will share your cost with Medicare at an 80-20 split. Medicare covering the 80%, you the other 20%. Note that there is no cap on your 20% share. If you have a Medicare supplement, your 20% share could be paid for fully or partially, depending on the type of supplement you choose. When it comes to enrollment, typically a person will enroll at age 65 if they are self-employed or already retired. Turning 65 is your first opportunity to enroll. This is known as your initial enrollment period. During this 7-month window, you may enroll into your Medicare beginning 3 months before your birth month, and you have up to 3 months after turning 65 to enroll. If you enroll in the 3 months before your birth month, Medicare will begin on the first of your birth month. Enrollment during your birth month or after will result in delayed coverage. You can enroll one of three ways. You can visit your local Social Security office, you can call Social Security, or you may enroll online at Social Security's website, ssa.gov. Now, if you plan to continue working after 65 and you have insurance coverage from that active employment, you are not required to enroll into Medicare. The same is true if you are covered under your spouse's insurance from active employment. Now, most people do enroll into Part A because it is premium free. You may defer enrollment into Part B until retirement, and you will not incur a late enrollment penalty fee if you are covered by insurance from active employment. Now, whether you should delay enrollment in Medicare depends on your circumstances. If you work for an employer with less than 20 employees, you may need to enroll into Medicare when first eligible because insurance from employers with less than 20 employees pays secondary to Medicare. If you do not enroll into Medicare in this case, you may end up with little or no health coverage because your health plan does not have a responsibility to pay until after Medicare pays first. Now, people with an HSA, a health savings account, that is paired with a high deductible health plan, they may not want to enroll into Medicare when first eligible. The reason for this is you would not be able to make contributions into the HSA once enrolled into Medicare. Contributions made while enrolled into Medicare could see a tax penalty. And as a reminder, once you begin collecting your Social Security benefits, you will be required to take Part A at the very least, meaning you would need to stop HSA contributions. Finally, if you choose to delay enrollment into Medicare, you may want to stop the HSA contributions at least 6 months before you plan to enroll into Medicare. This is because Medicare Part A has retroactive dating. It is backdated 6 months from your enrollment, but not before your 65th birth month. For these and other reasons, it's a good idea to seek additional guidance from the HSA organizer or a financial professional. Those who work beyond 65 and have insurance from that employment will be able to enroll into Medicare during a special enrollment period at retirement. Enrollment can be done anytime while still covered by the group health plan or up to 8 months after the loss of that insurance. Now, you should coordinate your enrollment into Medicare with the loss of your employer's insurance to avoid gaps in your healthcare coverage. Now, people who do not enroll during their initial enrollment period or during a special enrollment period are restricted to enrollment into Medicare Part A and B during the general enrollment period. Enrollment during this time is restricted to the first quarter of the year. Coverage would begin the first of the next month, and late enrollment penalties could apply. Now, for those individuals with limited income and resources, they can potentially receive help from the Medicare Savings Program, which would pay for the Medicare Part B premium. This slide communicates the income and asset levels one would need to meet in order to qualify for this assistance program. Note that the asset limitation does not include an individual's home or vehicle. Now, if you know someone who could use this information, you can refer them to Access Nebraska, a division of the Department of Health and Human Services. This is the program office that manages the Medicare Savings Program and other state economic assistance programs. On to our next topic, Medicare supplements, also known as Medigap. Medicare supplements are optional extra insurance that pay for some or all of your out-of-pocket costs associated with your use of your Medicare Part A and Part B. Now, companies must follow federal and state laws designed to protect you. Plans must be clearly identified as Medicare supplement insurance and are standardized. The standardization of these policies ensures that a company cannot modify the coverage that is provided. Additionally, all Medicare supplements are guaranteed renewable, meaning the company cannot cancel the policy as long as you pay your plan's premiums. Each insurance company decides which Medigap policies to offer and do not have to offer every plan option. Now, this slide provides a view of the 10 standardized plans. A checkmark indicates 100% coverage of that line item. Those with a percentage indicate that the plan pays that portion, leaving an out-of-pocket responsibility for the individual up to a limit. Now, there are also high deductible options available for Plan G and F. High deductible policies offer the same coverage as a Plan G or Plan F policy once an annual deductible has been met, $2,870 in 2025. Now, prior to meeting the deductible, you are responsible for the costs listed on the left of the above chart. These costs will go toward the annual deductible. As you can see, there are many options to consider. Premiums in Nebraska can range between $30 up to $640 per month. The premium is determined by the company, but approval must be provided by the Nebraska Department of Insurance. All companies selling Medicare supplements are required to sell Plan A since it covers the basic required benefits. Beyond that, companies are allowed to choose which supplements they want to offer. The costs associated with the other plan will be determined by the level of coverage being offered, as well as other factors. Typically, we can expect a plan to cost more if it offers more benefits. In this example, showing cost of a Plan G from Company Y versus Company Z, it's just another reminder that these plans are 100% standardized. A plan at $103 per month is offering the same exact coverage as a plan at $228 per month. You don't get anything more or anything less based on the premium that you pay. If you are considering a Medicare supplement, remember this one major fact. You have a one-time guaranteed issue right to purchase your Medigap plan. This is known as the Medigap open enrollment period. Now, this period is a 6-month window that begins when Medicare Part B is started for the first time at 65 years of age or older. During this time, you will be able to purchase any Medicare supplement from any insurance company selling it, and you cannot be denied. Anytime after your Medigap open enrollment period, you can shop for a Medicare supplement at any time during the calendar year, but underwriting will determine if the insurance company will offer you a policy, and if they do, at what cost. Now, due to the underwriting process, it could be important to take advantage of your 6-month guaranteed issue period if you are considering a Medicare supplement. Finally, note that beginning in 2025, people who qualify for Medicare due to disability will also have the same Medigap open enrollment available when their Medicare Part B begins, but insurance companies may not offer every plan option. When it comes time to choose a Medicare supplement, you can contact the Nebraska SHIP. We can provide you a full list of all of the insurance companies selling supplements in your area. This information is available for free upon your request. The only information we require to provide it is your zip code, your age, gender, tobacco status, and the desired plan. Okay, next, Medicare Part D. There are 14 plans available in Nebraska this year, each having a network that could affect cost. Plans have a formulary and are required to cover drugs in 6 protected classes. Beyond that, plans will typically cover at least 2 drugs from most other categories. Part D plans are purchased from private insurance companies and are approved by Medicare. In Nebraska, this year monthly premiums range between 0 up to $117.40. Those individuals with a higher income could see an IRMA. The plan premiums and other costs are set and do not change during the calendar year. The deductible can range between 0 up to $590. Copays or coinsurance amounts can range between $0 up to 50% of the cost of the drug. Finally, beginning in 2025, there is a $2,000 out-of-pocket spending limit on prescription drug cost. Regarding enrollment, much like Part A and Part B, you have the option of enrollment during your initial enrollment period or during a special enrollment period, typically at retirement, but life-changing events may create access to a special enrollment period, like moving. Additionally, there is an annual open enrollment period to review changes and potentially change your coverage for the next calendar year. Enrollment can be done on Medicare.gov, the official U.S. site for Medicare, or you can contact the Nebraska SHIP. Now, for those individuals who may have low income or limited resources, help is available to pay for Part D cost. This is known as extra help or a low income subsidy. Individuals or married couples would need to meet income and asset levels in order to qualify. Note that the asset limitation does not include a person's home or vehicle, but all other assets would be considered. Applying for extra help may be done online using the Social Security website or by contacting the Nebraska SHIP office. To recap the average overall cost of premiums within original Medicare, we see this could be between $185 to over $350 per month, depending on enrollment decisions. Medicare Part A is premium free for the majority. Medicare Part B has the standard cost of $185 per month unless an IRMA is owed or a late enrollment penalty fee. Potentially, a person could start over $145 per month for their Medicare supplement, depending on where they are within the state and other factors including their age, gender, and tobacco status. Depending on their drug list and other factors, a Part D plan could be more or less than $40 per month. Remember, your individual situation can be different depending on your options and decisions. Medicare is individual insurance. On to Medicare Advantage, also known as Part C. Medicare Advantage plans are the alternative to original Medicare and are purchased from a private insurance company. You are required to be enrolled into both Part A and Part B in order to elect a Part C Medicare Advantage plan. Now, because this option is enrolled into through a private insurance company, the insurance company is the manager of your Medicare benefits. Advantage plans can have prior authorization requirements. If the plan chooses not to cover an item or service, original Medicare does not step in to pay. Now, Medicare Advantage plans work by combining your hospital and medical coverage into one package, and generally, most plans will include Part D prescription drug coverage. Now, these plans must offer equal or better coverage than original Medicare. The better coverage typically comes from the inclusion of dental, vision, and hearing benefits, which are not offered by original Medicare. Now, each plan determines what extras to offer and what limitations to impose. Depending on the plan, dental coverage could be basic or comprehensive, and usually there will be a dollar allowance. For example, vision benefits in Nebraska are offered between $100 to $300 a month in 2025. Now, sometimes these extras or other services require prior authorization, so it's important to understand the plan's rules. This option is growing in our state, but there are some areas that are without this option. Now, what about provider access? Many Advantage plans in Nebraska are HMOs, or health maintenance organizations. These plans only cover care received in network. Any services received outside of the HMO's network generally will not be covered by the plan. Other plans in Nebraska include PPOs, Preferred Provider Organizations. These types of plans have a network, but also allow for some out-of-network coverage. Typically, you would pay 50% of the cost or less when going out of network. Now, HMO and PPO plans are the most prominent option, but Nebraska also has a cost plan option in some counties. Cost plans were introduced to Nebraska in 2019. This option is a hybrid following network rules of an Advantage plan, but will offer out-of-network coverage provided by Original Medicare Part A or B. The Nebraska SHIP can help you determine your plan options and what restrictions are in place, so you can make an informed decision if you are considering a Medicare Advantage plan. Cost of Medicare Advantage would include the continued payment of the Part B premium. Some Advantage plans may or may not charge an additional monthly premium. In Nebraska, one plan does charge an additional $152 per month on top of the $185 Part B premium. Now, other costs can apply. There are plans with health deductibles up to $500, and regarding drug coverage, Advantage plans are required to follow the same rules as Part D, thus the same deductible maximum of $590 for prescription drug coverage. Now, copays or coinsurance will apply depending on the services received. Finally, you should be aware that Advantage plans offer an out-of-pocket maximum on your spending. Depending on the type of plan chosen, the out-of-pocket limit can be between $2,500 up to $14,000 within the calendar year. Now, the plan will determine what costs apply to this maximum. Some plans count all costs towards the maximum, while others may only count certain Medicare-approved services. For example, some plans may only count inpatient hospital stays. Now, the cost of prescription drugs will never count toward the out-of-pocket spending limit. Dollars spent on extras also will not count towards the plan's limit on spending. Regarding enrollment, we see the opportunity to enroll is similar to Part A, Part B, and Part D. Additionally, Medicare Advantage has a second open enrollment period during the first 3 months of the calendar year. The Nebraska SHIP can aid in the enrollment process, or you can enroll yourself on Medicare.gov or work with a local agent or broker. To recap, Medicare Advantage plan cost can vary. You will need to be enrolled in both Part A and Part B and continue to pay the Part B premium. Depending on your chosen plan, you could have an additional monthly premium. Now, when deciding between your two options, you may want to weigh the pros and cons. Potential pros of Medicare Advantage plans include lower premiums, potentially extra benefits like dental or vision, and an out-of-pocket maximum. Potential cons could include plan rules such as staying in network, getting referrals to see a specialist, or having to get prior authorization to receive coverage of services or medical equipment. The final topic of this introduction is protecting your Medicare. Now, Medicare is reportedly losing an estimated $60 to $100 billion annually due to fraud and abuse. An example of fraud is when a provider bills for services that an individual did not receive. An example of abuse is when a provider orders unnecessary tests or procedures. But certainly, Medicare also sees losses through individuals with compromised Medicare information. Now, the result of this loss means lost tax dollars, which of course in turn could put the Medicare fund at risk. This results in less money for benefits, potentially leading to higher Medicare premiums or other costs. Now, certainly human error does exist, and not all errors are an instance of fraud or abuse. Most providers are honest. Unfortunately, fraud does happen, and only review and investigation will determine the truth. Now, identity theft is a serious crime that happens when someone uses your personal information without your consent to commit fraud or other crimes. And personal information includes things like your name, your social security, Medicare number, or credit card numbers. Now, here are some things to know about protecting your personal information. Don't share your Medicare number or other personal information with anyone who contacts you by phone, email, or by approaching you in person unless you've given them permission in advance. Medicare or someone representing Medicare will only call and ask for personal information in these situations. First, a Medicare health or drug plan can call you if you're already a member of the plan. The agent who helped you join can also call you. A customer service representative from 1-800-Medicare can call you if you've called and left a message or a representative said that someone would call you back. Now, only give personal information like your Medicare number to doctors, insurers acting on your behalf, or trusted people in the community who work with Medicare, like your State Health Insurance Assistance Program, or SHIP. Now, if someone calls you and asks for your Medicare number or other personal information, hang up and call us or call Medicare. When you get healthcare services, you should record the dates on a calendar and save the receipts and statements you get from the providers to check for mistakes. You'd want to compare this information with the claims Medicare processed to make sure you or Medicare weren't billed for services or items you didn't get. Now, after Medicare processes your original Medicare claim, you can review them by looking at your Medicare Summary Notice, or MSN. You can visit Medicare.gov, or you can call 1-800-Medicare. Note that the explanation of benefits, or EOB, is sent after your Medicare supplement or Part D or Medicare Advantage plan has paid for services or items. If you suspect Medicare fraud, error, or abuse, you can contact the Nebraska SHIP and SMP or contact Medicare directly. Before you file a report, carefully review the facts and have this information ready. You should have your name and Medicare number as listed on your red, white, and blue Medicare card. Have the name of the doctor, supplier, or facility that you think committed the fraud, and if possible, include any identifying number you might have, like a provider or supplier number. Other information may be necessary, so be prepared to jot notes down and gather additional information as necessary in order to further aid in the investigation of potential Medicare fraud or abuse. In conclusion, remember the Nebraska SHIP and SMP is here to help. We're available to help evaluate your Medicare options during your initial enrollment period into the Medicare program. We're available to answer any Medicare-related questions during the year and can provide help with problems such as billing issues or denials. We're also here to help with the application for the Extra Help program, and certainly if organizations would like to have a discussion or a presentation, we are happy to help with that also. Thank you for your attention, and remember to contact the Nebraska SHIP and SMP with your questions about the Medicare Health Insurance Program. Thank you, and have a good day.